Today's bill signing is the culmination of a massive effort on the part of our colleagues, Governor Pritzker, and advocates. A massive effort to put into law something that seems like it should be common sense. Health insurance companies should be focused on making people healthy. But somewhere along the line, priorities got out of whack. Instead of helping patients find the best care for their individual needs, the focus too often shifted to maximizing profits. These laws to be signed today put control back in the hands of patients and their doctors. They ban predatory insurance plans that charge more for a lower standard of care. They eliminate inefficiencies that cause patients to wait far too long for necessary treatments. They will lower health care costs, and they will save lives. So thank you again, Governor, Senator Peters, Senator Fine, for your great work and your dedication.
This is my message to Illinoisans. Illinois is moving in a positive direction when it comes to your care. Whether it's reproductive care, painful physical care, traumatic mental health care, Illinois, with this governor and this General Assembly and these leaders, is not turning back the clock nor turning back patients when it comes to your care. We're going to ease the stress for you and your loved ones during a mental health crisis. We're going to reduce the confusion when it comes to finding a provider. And instead of the steep steps of care that existed before, we're building an elevator to the treatment you need and deserve. We're ending predatory practices during your most vulnerable moments. In Illinois, we are putting care over cost. And I want to go back to Rush here. I have another memory. There was a moment after my dad died and before Obamacare fully took effect that I was dealing with a medical emergency that made it hard for me to get good care, particularly due to a pre-existing condition. I was desperate, and I came to this hospital's ER to seek help. I was lucky to have found a doctor who gave me antibiotics and sat with me as I struggled to explain the chronic pain I was in. He sympathized with me and gave me some advice. Our systems work best when it is putting people first and it is driven by those values. I know that there are countless others who have or are facing similar challenges in life, and I want them to know that today, as these bills get signed, we are all here doing this work with you, the person in serious need, front and center.
Imagine going to the doctor and learning of your diagnosis of cancer or MS. Now imagine your insurance, which you thought was there to protect you in a crisis, did not cover a new diagnosis, a pre-existing condition, or even your prescription medication. This nightmare has been a reality for countless people in the state of Illinois. These residents purchased short-term limited duration plans for their health insurance coverage. Sadly, these consumers found that when they were at their most vulnerable and needed to use their insurance, their plan had a high deductible and minimal coverage. This has left many under huge medical debt. Short-term limited duration plans, also known as junk plans, are exempted from the protections under the Affordable Care Act. These plans are not required to cover ACA essential health benefits like prescription drugs, maternity care, hospitalization, ambulatory services, mental health and substance use disorder treatments, or even emergency services. These plans cost the consumer and profit the insurance industry. Comprehensive health insurance coverage is required to have a loss ratio that is at least 80%, meaning the insurance pays 80 cents on medical claims for every dollar it charges in premiums. But junk plans have no mandated loss ratio, and in Illinois, some can be as low as 32%. That means junk plans, insurance companies are keeping 50% more profit than they do for comprehensive health insurance. That burden is on the shoulders of the consumer. With this legislation banning the sale of junk plans, individuals and families in Illinois will have a better option when they need coverage due to issues like job loss, turning 26, or moving off of Medicaid. Illinois will soon have a state-based exchange where consumers can go to purchase a temporary ACA compliant plan and possibly receive government subsidies to help them pay for this comprehensive coverage. This will ensure consumers have the insurance coverage they need for better outcomes.
Thanks for watching this video. Please like and subscribe to keep up to date with news from the caucus. For more information on what the senator is working on, please follow them on social media using the links in the description below.